State Senator Eric Berthel. I'm testifying today in support of Senate Bill 976, an act concerning healthcare coverage mandates for certain health conditions. I am specifically here to advocate well, of course, for the whole bill, but specifically for the section regarding treatment of obesity and providing insurance coverage. As a recipient of bariatric and metabolic surgery myself, I can attest that it is an effective and life-saving procedure. Obesity is a health crisis in our nation and state, and the surgery has a proven track record of improving many conditions that are associated with an individual being overweight. These health-related conditions include, among other things, type 2 diabetes, heart disease, stroke, and high blood pressure. Currently, most insurance plans in the state do not provide coverage for bariatric and metabolic surgery. The coverage is currently available to Connecticut residents who are covered by our state Husky plans. We've introduced this bill a number of times in the past. We made some forward motion last year, but it is absolutely beyond time to get this legislation passed. There is ample scientific data to support the efficacy of life-changing outcomes from metabolic and bariatric surgeries. Improving the quality of life via proven medicine should always be a priority. There is also ample financial data via health insurance companies to demonstrate that investing in metabolic and bariatric surgeries reduces the future cost of healthcare expenses. This includes many of the comorbidities associated with obesity. It is easy to understand how an investment in a life-saving surgery today offsets the often high and long-term expense for debilitating illness and diseases in the future. Bariatric and metabolic surgery should be considered an essential healthcare benefit in our state, as it helps individuals live longer and healthier lives. Many individuals will not be required to take as many prescription medications once they receive the surgery and lose weight, which lowers healthcare costs in the long run. All healthcare insurance should provide coverage for metabolic and bariatric surgeries. I respectfully ask the committee to look beyond the expense of doing this and instead at the tremendous change in the quality of life for these patients. I am a living witness and proof to this. The overall savings that will come from reducing and eliminating the comorbidities associated with obesity are worth investing in today. I urge you to pass this bill. Thank you, Madam Chair.
Thank you, Senator. I wanted to ask you, I see a bunch of these companies, Awaken 180, New York Bariatric, running ads. I hear it on the radio. I see the billboards. Are all of these operating with no insurance coverage, or are some accepting insurance? I was just wondering because I see them expanding.
So, Representative, thank you for the question. There has been a prolific expansion of bariatric surgery providers in Connecticut. They are most likely accepting insurance where it's available, but I can tell you from having been an advocate and kind of a mentor, if you will, for people who are thinking about this surgery, that people will mortgage their homes to get this surgery if they're private pay, if they don't have coverage. I would guess, not knowing exactly some of these providers that are outside of our hospital systems, maybe they're providing financing. I don't know, but it is so life-changing and so profoundly effective that people are willing to go and put their houses, if you will, or drain their savings account to have this surgery done.
And can you tell us a range of what it would cost today if you had private pay that didn't cover this, what the out-of-pocket expense would be?
Yeah, I can tell you that in 2019, my surgical procedure was covered by health insurance, but the initial billing was about $70,000. Yeah.
Thank you.
Thank you.
Any further questions? Senator Wong.
Thank you, Madam Chairwoman. Senator Berthel, thank you very much for advocating, as you have for many years. Having seen you in the House and seen the transformation of your surgery, I think you've taught me so much, but could you share with the committee that this was a health decision, not a cosmetic one, but a health decision that was precipitated by concerns? Can you share what led to your decision and your rationale to have this surgery?
Sure. Thank you, Senator. I appreciate the question. This is certainly not about cosmetics or aesthetics or looking good in front of a mirror. That may be one of the ultimate positive side effects of this. For me, at 47 or 48 years of age, I was hypertensive. I was pre-diabetic. I was turning my legs to get out of bed in the morning and had pain in my knees and my ankles. And 5-6 years later, I had managed to keep about 130 pounds off of my skeleton. So some of you have reacted in surprise to that. I'm not the smallest guy in the world today by any measure, but I can tell you that all of those things that that I was suffering with, or was looking down the barrel of a gun, if you will, that was about to affect my life as I approached 50, have all been removed at this point, which is amazing. It's absolutely amazing. You know, that you, and I don't, the only medication that I take every day is a vitamin, right? Where I would have probably been on high blood pressure medication and maybe insulin dependent. And if you look at the cost associated with that, and I know, Senator, that wasn't necessarily your question, but I think it's part of the discussion. If you look at the cost for one individual to be on hypertension medication for the rest of their life, okay, and all of the associated comorbidities of hypertension, the things that happen where they could have a stroke or a heart attack, the investment representative would have of $50,000, $40,000, if you look at what insurance actually pays, versus a lifetime of those medications and the comorbidities and the quality of life. You know, Senator Huang and I spoke years ago about how I wouldn't go outside and toss a football with my much younger kids at that point, because I was afraid I might fall down and hurt myself. Right? When I was morbidly obese and a lot larger. And that all goes away. It all goes away. And I can tell you that there are some that will say, why do we have to perform surgery? Why do we have to pay for people to stop eating? Just stop eating. Stop doing it. Stop shoving food into your mouth, right? It's so much more. Obesity is a disease, is classified as a disease by the Centers for Disease Control. And I'm guessing Senator Anwar probably has his hand up, because he has been an advocate as well and has supported this legislation in the past. This is making profound changes in people's lives. It's not about putting on a smaller shirt or pair of pants. It's about changing lives and giving people their lives back.
And I wanted to follow up on that. I mean, I think there may be, and you've been a tremendous advocate, but it's important for people to note that obesity is not a personal decision. And people kind of say lack of willpower and all that, but there are medical conditions, and it is a medical condition. And I think the recognition of that is another integral part of this consideration. But I also want you to be able to share that it is not an easy way out to managing your body weight, because you continue to be disciplined to manage your diet, to watch what you can or cannot eat. I think one of the examples you say is about carbonation, how it doesn't work. So it's a reflection of a body health decision with the surgery as part of the continual process of maintaining your health and maintaining your weight. Please share briefly, some of the considerations. So it's not an easy out. Yeah. It is a continual, lifelong effort to be able to maintain your weight and your health.
Thank you, Senator. I believe the best way that I could summarize this would be as follows. And I believe you'll hear testimony today from Dr. Benbrahim, who was my surgeon. He said to me when I had a first consultation with him that this is not an automatic fix. This is not a magic pill that you'll take. We're giving you a tool. We're giving you a tool to use that will help you, but you have to be committed and you have to manage this. Some people will say, the experts, certainly far beyond my ability to speak to this or knowledge, that obesity is not unlike an addiction to an opioid. That it's and the difference being that we can go to any fast food restaurant wherever you want, and you could sit down and eat a 10,000 calorie meal if you want. No one's stopping you from doing that. If you have some dollars in your pocket, you can go and eat whatever you want. Where maybe access to opioids and or illegal drugs is not the same. It doesn't come with the same ease, but the addiction is considered by many mental health experts as even more powerful than the one that comes from some of those illegal drugs. So it is an ongoing daily routine to manage this process after the surgery. The surgery is the first step and the tool that is given to help you control future weight gain.
Thank you, Madam Chair, and thank you for your leadership and awareness of this and helping raise awareness. Thank you, Senator Berthel.
Thank you, Senator.
Thank you very much.